right, so if you're both ready to go, we're gonna open up the Zoom and officially welcome everyone in. Bonjour, bienvenue tout le monde. On behalf of Fourth Space, the new initiative, welcome to Black Community Health Check. We are streaming on YouTube live from Concordia University's Fourth Space, which is located on unceded indigenous lands in Tiohtià:ke. At Fourth Space, we collaborate with our university community to bring people together around the research projects, initiatives, and dialogues and development across the university. So to that end, it's our pleasure to have collaborated with Annick Maugile Flavien to host this week's series of events focused on Black community health in the home, the community, and healthcare facilities. We're excited to get the conversation going and to meet your guest, Annick. So over to you. Welcome.
Welcome. Thank you. Thank you, Anna. Before we get started, I just wanted to take a moment for National Truth and Reconciliation Day. For anyone who is looking to get information about it, there's information on our Concordia website, as well as many other avenues online to learn more about this really important day in our history. I am here with Ariane today. This whole week, we've been having conversations around Black community health, and part of this is for the work that I'm doing in my PhD, looking at Black community health with a particular lens on caregiving and what an important role it plays in creating accessibility for our communities. And I wanted to bring in experts from different fields and perspectives who do many different types of healthcare work and also different types of care work. And so today we have Ariane Métellus here with us. Ariane Métellus is a social entrepreneur, consultant, speaker, birth and perinatal worker. She is passionate about perinatal, sexual, and reproductive health, more specifically obstetrical and gynecological violence and racism in Quebec's healthcare system. She is the regional recruitment coordinator for the province of Quebec and sits on the steering council committee of the RESPECT study. RESPECT standing for Research Examining Stories of Pregnancy and Childbearing in Canada Today, at UBC's Birthplace Lab. And she's also on the board for the Breast Cancer Action Committee and on the steering committee for L'Accord Féministe. So welcome. Thank you for being here with us today, Ariane.
Thank you for having me.
Yes, for sure. That is a very impressive bio. Thank you for sharing that with us. But sometimes when we read these dense bios, we don't really get a sense of what that looks like on a day-to-day. So can you tell us a little bit more about your day-to-day work? What does that look like? And how did you even end up on this path?
So my day-to-day work right now is more a full-time mom of 5.
That's a lot of
but on a professional level, I do right now more consultant work. I do some birth work, but with the pandemic I was pregnant during the pandemic and I gave birth during the pandemic. So my activities as a birth worker have slowed down a lot. So why did I come to work? I have a background in music, so it has nothing to do with everything I'm doing now, but my experiences, it's really my experiences, my birth experiences that really pushed me to come and work in the perinatal world, because I had too many questions and I didn't understand why I had so many questions that I couldn't find answers to, actually. And I could get some answers as I got pregnant. So with my second, with my third. And then I was like, why didn't I get to know all of this when I was pregnant with my first child? And as I was talking to other people, other pregnant people around me, I realized that a lot of us didn't have that kind of information and that kind of support. So I started out as a doula, so a birth worker. And then eventually I saw the need in Black communities and I saw the disparities too. And I didn't understand how we didn't have documentation, data, on our experiences as Black women, as Black people in the healthcare system, but more so concerning the perinatal world. And that's how I started getting involved in different organizations or different events. And that's how I started.
Amazing, thank you. So, you said that there was these social disparities that kind of brought you to think about Black community health. What does Black community health actually mean to you? Like, is it is it the social disparities? Is it a framework that you hope to see in the future? Like, what does that term mean for you?
Just on top of my head like that, for me, Black community health is, first of all, support from our communities. So, because we hear a lot, so I'm going to say why. We hear a lot of needs for research, for data, consultations. We want to understand what's going on in the Black communities regarding health. But I don't hear enough, and I think I'm part of that too, problem, but it's not, it's larger than just an individual, of course, but I don't hear enough concrete actions in our spaces and in our communities concerning Black health. So for me, when we talk about when you say Black community health, for me is really, we need more support, but concrete support, more actions, more services in our communities. I don't know if it answers your question.
That answers my question perfectly. Thank you. And one of the reasons I was so excited to bring you to the table today is because I think one of the things that's so amazing about birth work is that it happens in so many different spaces, right? Birthing can happen, it could happen even in a car, right? So there's so many different ways that it can happen. And so because of this, I imagine as a birth worker, you've had the opportunity to be with people in different spaces, whether that be in health institutions, in their homes, or so on, in the community, et cetera. Can you tell us a little bit about the ways in which, like the uniqueness of your work and the fact that you get to kind of you've had the chance to move with people in those different spaces, and how has that experience been different, say, in a health institution versus somebody's home or in community, what do they call them, birthing centers and so on?
So I will say this, and maybe it's peut-être que c'est un peu généralisé, mais c'est ma constatation, and that's what I observe. What I see is from safety and a sense of safety from the birthing person. What I see is when we're at home, there's that sense of safety, of security, where I'm more at ease when I'm at home. Because I have mes repères. Sorry, I'm going to be switching French, English.
You're very welcome.
Parce que j'ai mes repères à la maison, right? So, and because, let's say it, the medical institutions are very violent towards our communities. So for me, what I see is once we set foot outside of the home, we have a lot more, comment tu dis ça, des inquiétudes, but la méfiance, voilà. That's the word that I was looking for, la méfiance. On a beaucoup plus de méfiance envers les institutions, et qu'elles soient médicales, qu'elles soient sociales. Je pense par exemple à la DPJ. Je pense as soon as you go in the system, for me, what I observe, and it's not for everybody. Some people feel very safe in the health system or institutions, but the large majority don't feel safe. For me, we have that safety of the home, but also, I know that you were talking about my work. So what I see is when I'm at home with people I support, they're going to be at ease, but also en confiance. Et plus détendu. So the stress level decreases, right? Quand je sors de ces contextes-là, so I have to, the advocate in me has to be in the forefront more because I feel like I have to protect, right, the people I'm supporting. And that's where I find it, je trouve que c'est dommage parce que I think that our communities, we deserve safe spaces, we deserve dignity and respect, especially when we're birthing, but dans toutes les sphères de la santé, bien sûr. Yeah, so what I see is, and in institution like, let's say, research context, or on voit de plus en plus for us, by us in the research realm. But what I feel sometimes is that we're seen as subjects more than humans. I don't know if it makes sense.
Yeah, no, for sure.
And I don't have the answer to that, but how could it be? How could we make it so it serves the communities, the researches that are going on now? A lot of them are going on now. How can they serve, and can they be practical, on a practical level, serving to our communities, instead of just like, oh, let me observe, let me see, oh, that's what's happening. And then we talk about it, mais dans l'académie, plus que de créer des ponts entre les recherches, le milieu de la recherche et les communautés directement. Je sais qu'il y a de plus en plus de ça, je sais qu'il y a de plus en plus de recherche collaborative, donc en partenariat avec les communautés. But there's a lot of work to be done towards much more collaboration between those spaces.
I appreciate what you're saying. It's echoing a lot of, so yesterday we had kind of a public, we talked to the public in these like short interviews, and a lot of the things that the community was saying was that they would wish that the Black community would feel safe in all spaces, right? And that they would be able to be valued in all spaces, so that there's, that they can bring their full selves, and then they require less of this advocacy that you're talking about, right? And obviously this is like the long-term wish, and something that we all like hope for sure. But we know that we're coming from generations and generations of systemic racism, and that it's not kind of like a magic wand that we get rid of that. And this is why I find that the role that you play as a birth worker and a community advocate to be such an important role, in terms of what does that mean? Like, how do we find a way to extend that feeling of trust that you were talking about in terms of the home as much as possible, right? Like, if we were to open up the radius of that in terms of where Black community members can feel safe. And I find that caregivers, in all different types of contexts of what that caregiver can be, right? Whether it's a birth worker, partner, et cetera, are able to extend that radius by being advocates for our community members. And so can you tell us a little bit more about, what you said that as soon as you leave these spaces, right? Like, you leave the home, now you're in the community or you're in the health institutions, and that turns on this advocacy aspect of your work. And so what are some of the, what enables you to be an advocate? Like, you talked a bit about education and throughout from pregnancy to presidency that you got, but what is it also that you do in these spaces that's maybe different than you would do in a home, in order to really be able to best serve the communities that you're working with?
So I have to, je dois être beaucoup plus vigilante when we set foot outside of the home. So I have to be mindful of what's being done, what's being said. And sometimes it doesn't happen often because that's the thing too. When we're birthing, right, we have to be calm. We have to keep that bubble, right, intact, so that the birthing person can birth in peace with dignity. So sometimes you have to speak up, but you have to know when to speak up, because is me speaking up going to be more harmful to the birthing person? Is it going to solve something right away or not? Is it something I can solve after, that can be solved after? I'm going to give you an example. Let's say a birthing person doesn't want to have an episiotomy, so cut the vaginal, le canal, le périnée en fait. And they've said, I really don't want that intervention. Please don't do it. And then you have this doctor who's like, it's best if we do it. Research, so I've heard that. Research shows that it's better if we do it. And I'm here and I'm like, research doesn't show that it's best if you do it. So what am I to do as a birth worker, as an advocate? Am I going to say something right now? Yes, because I mean, c'est irréversible, right? Mm-hmm. But for something like the tone or the way they're speaking, yes, I could say something, but I don't want to stress the person. So I'm going to keep it to myself and then after maybe say something, right? So I always have to be mindful of what's best for the person I'm supporting. I have to watch what is being said, what is going to be written in the file. Is it really what's happening? Are they consenting to everything they're imposing or proposing? So I have to be there for the person, but also be very, very, very mindful et très, très vigilante à ce qui se passe à l'extérieur de sa bulle quand cette personne est en train d'enfanter. Mm-hmm. So it's, what's the uniqueness? I would say that it's just, we have to be, c'est comme des gardiens. So in English, keepers,
yeah, exactly,
right?
The keepers, for sure.
The keepers of the space.
You know what's interesting from some of the things that you're saying, I feel like, so right now I've seen that in birthing communities, and there's been a rise of doula trainings and education that's out there, and et cetera, et cetera. And a lot of the focus of, let's say, the more mainstream ones is kind of this anatomy like focus, or just like, you know, what do you do as a doula? And a lot of what I'm hearing from you is actually community advocacy that seems to be pretty specific. Well, not necessarily only specific to Black communities, but that there is a certain sensitivity that comes from being a Black birth worker, from your own experiences that you're kind of pulling from I'm assuming as well the experiences that you've seen with the birthers that you've worked with, and so where do people learn that? Do you find that we, at least in Montreal or maybe nationally, are building a nice community of birth workers who have a sensitivity for Black experiences, who understand that, are creating trainings where that will be at the forefront as well of the work, and not just the kind of the technique base of what birth work can look like?
So I would say, unfortunately, here in Quebec, in Montreal, we don't have enough training that take into account cultural competency or cultural safety sensitivity. Of course, they're going to talk about it a bit, but with their lens of like white and the majority, there is more and more opening, but it's still here in Quebec, in Montreal, what's missing is really a training for us by us. or by us, not necessarily just for us, but by us, definitely. For me, and I'm really sad to say this because I've been working in with organization in the, on appelle ici le mouvement d'humanisation des naissances au Québec. I've been working with them for almost 10 years. I've been trained as a doula about 10 years ago. And these are very wide spaces. And we lack this movement. We need that same movement in our communities. So yes, you're going to have like different Black doulas working. You have different initiatives, but not enough. We don't have those institutions in our communities, these organizations in our communities that would help us create those trainings that are appropriate and much more, qui prennent beaucoup plus en considération nos réalités et nos besoins. So yes, you have to go, let's say, towards the United States. And what the pandemic did, one positive thing that the pandemic did was to enable us to participate in different trainings that are given in the United States or international at l'international, right? Sinon, like, it's not accessible. You have to travel, you have to pay, it's really not accessible. And the other thing too, when I'm talking about accessibility, I'm talking about financially. These trainings are very expensive because it's private, it's not public, right? So we need, and because there are so many disparities in our communities and at different levels, we need to take that into account too. How to make those training accessible for our communities. And when I say our communities, not just the Black communities, Indigenous, racialized communities, marginalized communities. So we need to make these trainings available and accessible to us, to them. Also, they need to be more doivent être mieux adaptés, voilà, à nos réalités. And it really saddens me to say, but it's not the case here in Quebec. Some organizations are trying and are putting some effort toward being more culturally secure or safe, but it's not it.
Yeah.
Like, it's not it. And I'm at a point right now where I call them out because ils sont carrément dangereux pour nos communautés.
Right.
Not only they're not safe, they are dangerous.
Yeah.
Some of them are like, I understand the need for money and for financing, but some of them are taking money from, how could I say that? C'est un cercle vicieux.
Right.
Dans la surveillance de nos communautés, dans la criminalisation de nos communautés. So, je vais te donner un exemple très concret. Il y a un organisme qui a accepté une subvention, puis l'affichage de poste, c'était accompagnante périnatale à la prévention de la négligence.
Okay.
Mais, so then you're like, prévention de la négligence. So comment tu peux voir qu'il y aurait peut-être de la négligence dans une certaine famille? Comment on prévient cette négligence?
Yeah.
Ce que je déplore is that non seulement c'est très violent comme titre, ils l'ont changé éventuellement, mais aussi c'est qu'il y avait un autre affichage de poste pour le même organisme. Et c'était accompagnement périnatal aux familles, par exemple. And in that one, you didn't have to have knowledge concerning Black communities, Indigenous communities, marginalized communities. But in the other one, it was specifically written that you have to have knowledge concerning those communities. And nobody in that space felt the need to say, something's not right about those.
Yeah, the parallel that's being made right there.
Exactement. So for me, it's very dangerous. So because we don't have those spaces in our communities, a lot of other organizations are going to refer newcomers, refugees, people in our communities. They are referring people to these spaces that are actually dangerous for us, that are not safe. And of course, you have the yes, but that's not our intentions. And, but they don't see the bigger picture. And that's where I think we lack education and we lack knowledge as to, it's not just about the birth work. It's also about the impacts of all those lack of safety, lack of consideration, and the impact on the families and on the next generations. So for them, it's just like, okay, how can we make it so that we have the money to give and offer services for now, but they don't see the long-term effects of these. I don't know if it made sense.
No, that's very clear. I think one of the things that comes up for me when I hear what you're saying is, how do we get to a point where supporting us is not charity work, first of all, right? And that it's not seen as something that there is innately a problem within the community, but rather like a zoom out of like, well, what are the social contexts that are creating this situation? How do we address those in order for communities who would otherwise be thriving continue to thrive the way that they should be, and taking away these stressors? It makes me wonder, from your perspective as a community advocate, birth worker, if there was something that you would want your peers to know, that you would want other health professionals to know about Black communities as they try to, there's been a bit of a racial awakening, let's say, in the last few years. So as they enter these spaces, right? Because now more and more people are, like you say, trying to do research and so on. And so what would be some of the things that you would like these health professionals or community advocates, birth workers, and so on, to think about when they enter Black communities or know about Black communities, plural?
I think people need to know, first of all, that we do have the answers. If you listen to us, if you consult us, we do have the answers and we know what we need. We have a lot of knowledge. We have a lot of ancestral knowledge. And this knowledge is rich. Peu importe nos backgrounds, peu importe nos origines, we have the answers. And people need to let us decide what's good for us. So that's the first thing I would say. Listen to us and see us as your equal, not as, oh, we need to help you. Oh, we need to, that's unfortunately, often that's what I see. Let me do it for you because you don't know what's good for you.
Yeah.
Let me tell you what to do. So a lot of spaces too, what they're going to do is, here's how it works here. But they're saying that to a woman, let's say that just came here, yes, but who already has like 2 kids. She gave birth, elle a donné naissance au pays, right? She knows how her body works. She knows what she needs to be doing. She knows what she needs to be eating in order to feed her baby, to feed herself. So it's like we forget, once people come here, they forget that they're human and that they had a life before coming here, right?
Yeah.
So I think that's what I would say. listen to us.
And then in the reverse, if you were thinking about Black communities, again, plural, what would you want our communities to know about health professionals, health institutions, or community advocates, and these people that are, ideally at our service as well, right? Like, what would you want our communities to know about them?
I don't know if I would say what I want them to know about them. Parce que pour moi, ça sonne un peu. Je veux pas généraliser, right? But I will say this. There's a history of violence and of racism in those institutions. So even if somebody means well, and is nice, we cannot forget that they work within a system that wasn't built for us. So you need to know your rights. You need to be open-minded. But unfortunately, you always have to be very vigilant as to what kind of care you're being offered. The consent, are they asking for your consent? So I would say this. I wouldn't say what I want our communities to know about them, but more what can you do when you enter those spaces and when you're in front of people within the medical or the institutions here. I would say know your rights, get educated on whatever, like if it's you're going to birth, if it's because you're sick, whatever, know your rights and make sure you're always with someone too, if possible. And if you can, try to find somebody or people who would have some knowledge to support you in your journey, in your health journey.
This keeps on coming back up in these interviews, this idea of I guess, community education, one, that we know as much as possible. This idea that we need support when we go into these spaces. I find it really interesting that that's the kind of reoccurring advice that's coming up. And I think it speaks volumes to the type of interactions that we might have in health institutions and in community and so on and so forth, that we consistently need a bit of a buddy system. And then I also think that it kind of reflects back to us a sense of what is also lacking in our community, right? So the fact that we're not educated, right? Because we may have been born here, may have been born elsewhere, et cetera, but we're not educated about the history of the system here and how that will impact our interactions, right? So one of the things that I've encountered a lot in my work and also prior to my work is that often, particularly with the younger generations, like younger people, not the younger generations, but younger people, they tend to think that it's a them problem, like something, they went into some sort of interaction, the interaction went bad, and they come back thinking, what did I do wrong? Versus understanding that there's a whole system at play here, that it isn't actually just that one-on-one situation, though you are the one that's gonna carry it and take that home, right? And that impacts you. And how much that education can really alleviate the stressors that one individual can experience. What are some of the initiatives or communities that you stay in contact with in order to kind of promote that community education? Like when you're looking to get educated, like for example, you were saying that from birth to birth, you got more educated. What are some of the sources that you look to get that?
So they're not here. They're not here. Concrètement, you want names and places?
Anywhere, it doesn't really matter. Like, I guess I'm trying to understand, is it something that is like, is it by getting online? Is it by getting trainings? Is it social media? Like, where can somebody who, let's say, it's the first time that they're thinking about their own health as like a Black being in the world, and they want to start, like, knowing their rights, right? Like, where would they start that journey?
So yeah, online, definitely. There's a lot of resources, sorry, online, a lot of them. There's also, how do you say that? You know, I want to refer to certain organizations, but within those organizations, there is so much violence. Et c'est très insidieux, hein? C'est tellement pas direct, and you would think that those organizations are sensitive because they work pour la défense de droits, par exemple.
Yeah.
So right now, I'm really sorry that I'm not quite answering your question, parce que j'en suis à un point où I'm really afraid to refer people to certain organizations that exist here, right? So what I'm trying to do also is work in collaboration with existing, let's say, existing organizations to maybe bring them some knowledge concerning the rights, everything we've talked about. So yeah, I'm not answering your questions because I'm still thinking about it. Je suis à un moment, en ce moment de réflexion where I'm like, je réfère les gens beaucoup online ou aux États-Unis because here I feel like something needs to move, something needs to change before I can, en toute confiance et en toute tranquillité d'esprit, référer les gens à certains espaces.
I think that you're answering another question that I have in your response, though, and something that I think is so important to talk about. Of sometimes when we do this type of work, or any type of anything, I think often when we look at anything from a Black perspective, there's often this tension where people are like, well, why don't you just participate in what already exists? Why does it have to be Black specific? Why this? Why that? And that tension keeps on coming up of like, well, there's already services for that and they're for everyone. So what's the big deal? And et cetera. And I think that what you're saying here really sheds light on this idea that if we can't even enter those spaces, we can't even safely refer people to those spaces, then it's as if it doesn't exist, really. That just means that, there might be 10 organizations, but for us, there's actually 0. And I love that you're highlighting this aspect, right? And we're kind of dealing with that live of like, well, what does it mean to like responsibly send our community into spaces that we know have very complex, often very violent histories. And then also that we know that they will not necessarily be held in ways that are beneficial for them on a long-term level, right? So even if there is a resource, technically there isn't a resource at all. And so one of the ways that you're addressing this is by working with some of these organizations. Is there other kind of pathways that you're hoping to see in the next decade, let's say, for these organizations to kind of shift that, and how, if we were to look at the States or maybe even other provinces in Canada, how have you seen that shift happen?
So in the States, of course, on peut pas comparer, because in the States, they're very organized and they've been organized for a long time. The rest of Canada, I would say Ontario, they are organized much more than here in Quebec. So I will talk for Quebec and for us here. What I would want to see is more spaces for us, more spaces by us. Okay, I will say this, more spaces by us. So you were saying if we cannot enter those spaces, we can. We've tried. It's just not working. Okay, so it's not working because Oui, il y a l'ouverture, mais il y a beaucoup de tension. A lot of tension. Because, of course, when you go in and you say your space is not safe, people tend to be en réaction et sur la défensive, right?
Oui.
So then it creates a lot of other problems. Moi, ce que je dis, c'est we do not have time. Our communities, il y a l'urgence. OK? Moi, je peux pas dire à la personne que j'accompagne en ce moment, par exemple, I cannot tell her, well, things are changing. Je peux pas lui dire ça. À la personne, par exemple, qui est à l'hôpital, qui est en train de se faire violenter, je peux pas lui dire, on va attendre que la plainte soit déposée and then things are going to change. C'est pas possible. Hein. Je veux dire, so there's a sense of urgency that makes it so we don't have time for these spaces to change. I'm very happy for them. I'm happy that they're opening their minds and opening their spaces and getting educated. But the person that is here and now doesn't have time for them to get to where I would want them to be in 10 years. Right? So for me, there's a sense of urgency. What I want for them is to listen to us. Right? Et puis, ça va plus haut que ça, en fait. C'est que we need new spaces.
Yeah.
I am tired of trying to change or make my voice or voices be heard in those spaces. For me, that's not working anymore. Yes, we can work in collaboration, but that's not what we need now. Now, what we need is new spaces by us. And I'm saying this, I'm listening to me saying it. I never thought I would be saying this one day. But yes, we do need those spaces by us. And the thing is, quand je dis ça va plus haut que ça, c'est au niveau du financement. Parce que ça nous incombe toujours en tant que communauté. Et si ce sont des nouveaux projets, par exemple, de trouver du financement, de prouver qu'on a besoin de ce financement, comment on prouve qu'on en a besoin et que c'est un besoin? You need that data, right?
Yeah.
You need proof that you need those things. So, ça va beaucoup plus haut. Ça va au niveau du financement, vraiment. It all comes back to money. At the end of the day, we need resources. We need human resources, but we need financial resources. Parce que ce sont toujours les mêmes qui sont financés. Because they have, ils ont de l'ancienneté, parce qu'ils sont là depuis longtemps, parce qu'ils font beaucoup d'activités. And one thing I find hard also is that I'm a Black woman, right? So as a Black woman, I'm fighting for other Black birthing people. I'm fighting for, but all the while going through those things too.
Yeah.
So as a community member, I find it very hard to navigate sometimes. Where does my advocacy, my work finishes, and where is it me? Et c'est toujours les mêmes choses qui reviennent. So we get exhausted parce qu'on fait le travail. We do the work because the work needs to be done. But more often than not, that work is being done, c'est du travail bénévole.
Yeah.
Right? Mais des organismes, puis je vais le dire comme ça, des organismes blancs qui sont... qui veulent, par exemple, travailler sur des sujets qui nous concernent en tant que communauté noire et racisée et marginalisée, eux vont recevoir du financement pour travailler sur des sujets qui nous concernent ou pour offrir des services qui nous servent, which for me makes no sense.
Yeah, for sure.
You know, why not finance the communities? Et oui, de plus en plus, il y a du financement pour certains projets, yes, mais pas assez. pas assez, and people are waiting for data. People are waiting for. We don't need to wait for these things. Il y a une urgence. I'm sorry. Je commence à m'énerver.
I'm also hearing in what you're saying that there's space for like support us in supporting us, right? In the sense of like how can these organizations who do have the seniority, the connections, the grant writing skills, and so on and so forth, to pull in all this money, really start thinking about what meaningful partnerships would be with community and other community organizations, and being like, okay, well, you know what, if the government's going to give it to us, well, how do we funnel that to the community as well, right? Because we know that there's certain systems that take a really long time to change, and if granting bodies are not going to get to a point where they're giving the money directly to these newer community organizations and so on and so forth, then how can we see community organizations change their narrative a bit and start thinking about what meaningful partnerships would look like in the community. I'm also hearing, this need to really think about how the scaling change, right? I love how you talked about urgency and how, there's certain things that, yes, we can wait for 10 years for this thing to happen, and that we know that that's kind of the never-ending work that will happen. But then there's certain things that need to change yesterday. And so how do we have these different scales? How do we create community awareness, the education, the support, and so on and so forth, in order to be able to address these different scales? I really appreciate you bringing that to the forefront. And then lastly, I want to echo back this aspect of what you're saying in terms of how often caregivers in our community are lacking care themselves, right? And so there's this kind of vicious cycle of, if we're creating burnout within our community, who's actually able to pass down the torch from person to person, because there isn't necessarily that type of system. For yourself, as someone who's a birth worker, a community advocate, a mother of 5, and I'm sure the list goes on and on and on. When you think about caregiving in the Black community, and you obviously do so much of that, are there avenues in which you're able to tap into care for yourself, that you can kind of reach out for care and support? And do you find that as a caregiver, there are systems of care for you in either inside of the community or other communities that you engage with?
I think that it's something that's missing. Quand je dis missing, I think it's on a more official level. And it's funny because all our conversation brings me to, some projects I want to be working on and that I have in mind that I wrote, but you need time, you need money, but it's really that, like, how can we create spaces for us as caregivers? How can we support one another? And I think, de façon individuelle, everybody, no, I won't say that because it's not true, but rewind. Sorry, I wanted to take it back. Some of us have the privilege to have our village, right? Mm-hmm. But I also think that our villages also get tired, right? Alors pour moi, c'est vraiment, ça rejoint tellement d'aspects et de niveaux de nos vies. For me, it's just really time for us to create those spaces.
Yeah.
Mais they really officially create those spaces, comme par exemple, à l'université, you're going to have spaces where people can go and get resources and get some support. Dans certains organismes aussi, tu vas avoir ce genre de support, but where can I go aside from my friends or my family where can I go on a day-to-day? Find that support. I don't have that answer.
Yeah.
You know?
I think it's one of the tactics as well, right? You know, you use the word village, and I think that that's so key because village is a very, you know, I speak Spanish as well, and pueblo, you know, in Spanish is like the physical space, but also the kind of the relationships and the people, right? And so, like, I love the aspect of village that is very concretely in the physical world, in the sense that we know that historically part of the way to break down cultural relationship and resources and so on is to actually separate people in where they live, right? So the village is no longer as strong because it doesn't have the physical space, it doesn't have this kind of common place to come back to, where everybody kind of moves through the same space. So, you know, when I hear you talk about the village of families and friends, I know one of the things that happens often in Montreal is that, you know, even though we are a relatively small city in comparison to other big cities in the world, you know, you may have a friend that lives 20 kilometers away, or and so on and so forth. And so what does village support look like when you're not in the same neighborhood, when you're not able to see each other every day, and how much can we support each other through online or phone or so on and so forth? Sometimes you need somebody to bring you bread in 5 minutes, right? And that's not necessarily going to happen through a Zoom call, let's say. So I really appreciate this idea of thinking through, you know, what does space mean for us and how key that is in this conversation about Black community health.
Can I add something?
Yes, please.
Very quickly. There's also isolation, right? When we talk about we're being isolated, there's also the stigma, the shame that comes with us not being able to provide anymore. And when I say provide, it's financially, mentally, spiritually. There's a lot of stigma that comes with that. So yes, you want your village, but at the same time, we need to break that stigma, to break those taboo. It's okay not to be okay. You cannot always be okay. And yeah, for some people, they're not okay for years. But can we understand that it comes from way back, and that we have been supporting, and we have been advocating, and we have been working for so many years? At one point, we break. So, parce qu'il y a aussi beaucoup ces stigmas-là dans nos communautés, where it's like, mets femme sous, en créole, on dit mets femme sous, you know, put your girl panties on and just like keep moving, right? And it's just keep going, keep moving. Yeah, it's sad. Yes, you were hurt. Yes, this, yes, that, but you need to move forward. And that, for me, we need to break that cycle of being strong Black women, being strong for ourselves, strong for our families, strong for our communities. So I think, yes, we have to have these spaces, but we also need to acknowledge that sometimes these spaces do not acknowledge fully like our needs. Yeah, my 2 cents.
We're getting close to the end of our time together, so I want to kind of leave us with a question that allows you to kind of think back on our conversation, and if you were to prioritize, let's say, the top 3 changes that you'd like to see in Black community health, where is your heart and soul right now? Like, what are the things that you are finding most urgent for our near future?
Concrete actions. I was ready for that one.
Yes, been waiting.
Concrete actions for me now, because for a couple of months now, it's like, nope, something needs to be done. Concrete actions. We need to put things in place now. For me, it's where to get the funding, where to get the money to get things going, to have, and I'm going to be very honest, I'm saying this also because I do have a project that I want to be working on, but I promised myself that I would not be working on that project if I didn't have the funds to work on it, because I have a family to feed. Not only that, if I want to have people embark in that project, I will not ask them to do it voluntarily. I know some will, but no, we need to ask for what we need, and we need to get what we ask for us to be able to do the work and to continue doing the work, because we've been doing the work. So for me, it's really a question of, we need to get organized around birth work, around health, for sure. I don't think that the organization is the problem.
Yeah.
I think the financing is the problem. Because once you get organized, c'est pour ça aussi que les projets meurent. Because I've seen some projects, beautiful projects, but eventually they die because it's not sustainable for anybody.
Yeah.
So for me right now, it's really about concrete. What can we do now for our communities? Who can we support? Where can we support? And you were talking about, like at the beginning, you were saying, what does community health, Black community health means to me? For me, that's what it means. It means support one another, for the community to come together, for the communities to come together, really, in support of.
Well, first of all, I support it 100%. And I want you to get this financing, because I can only imagine what's going on in your head right now. So tell us, where can people contact you? Where is, this big funder, when they check out this interview, where are they going to email you so that they can send you all the money to make this happen? What are your socials? Tell us how to stay in touch with you.
So I'm really not good with social media, but I try. So I'm on Instagram, I'm on Facebook. So on Instagram, I think my handle is, arianeka.perinatal.
Arianeka.perinatal, right?
Yeah, on Instagram. On Facebook is Ariane Métellus. Also my email, very simply, arianekametellus@gmail.com. So ARIANE-KMETELLUS@gmail.com.
Amazing. Is there anything that you have coming up soon that you would like us to kind of talk about?
I have things coming up, but honestly, like, check it out.
It's too early in the morning to be talking about that.
Yeah, really. I'm like, my agenda, but I've been asked to talk in some spaces, but follow me on social media and I'll try to put things up. I haven't been up to date with my social media. Je vais essayer de remédier à ça bientôt.
Amazing. Thank you so much, Ariane, for being here with us. It's been really, really beautiful to hear your perspective, and I really appreciate the urgency that you're bringing to this work and this idea that, there's so much within our community, and that if we have the financing, we have the concrete support, the long, sustainable support, we are able to do it, right? We don't need somebody to come and do a Band-Aid situation for us. So I really appreciate that.
Thank you for having me. Thank you for the work you're all doing. Very important.
Thank you.
Well, on behalf of all of us behind the scenes here at Fourth Space, Ariane, we really appreciate you coming online for this very important, very powerful conversation, I might add. And maybe I'll also just add that as the teeniest, tiniest concrete action that we will take here is to ensure that we spread the word far and wide to make sure that this conversation gets out there across all the media and people can listen to it. There was a lot of interested people who registered. We're going to make sure that we're going to get this convo to them. So thank you for your time once again. We appreciate you. Thank you, Annick, once again for bringing in such an amazing guest and for keeping the conversation open and going with all of us in this space here today. All right, folks, we're going to close up the Zoom and the live stream. We appreciate your time. We look forward to seeing you this afternoon, hopefully at 1:30, when Annick will be in conversation with Marianne Lopez. Stay tuned for that. Thanks very much. Ciao.
If you have an idea for a podcast, please let us know. You can contact us by email at info.4@concordia.ca or find us on social media at CU Fourth Space. We'd love to hear from you. The Fourth Space podcast is hosted by me, Douglas Moffat, and produced with Anna Boklovec. Editing by Chanel Lees Marshall and Maximus Delmar. And our theme music, courtesy of Supercontinent. Thanks for listening.